You are watching Viva. September 28 is World Rabies Day, and so this will be our focus for today. Not normal for us to discuss rabies in this country, but of course this has been a pertinent issue. There has been yet another area in Sarawak that has been declared rabies infested. So far, this is the 25th location that has been issued as rabies ridden in that state. And so the Secretariat for the Sarawak State Disaster Management Committee said that these include 20 areas in Serian, 4 in Kuching, 1 in Sri Aman. The rabies infection in humans was first reported in Sarawak in June last year. And so far, 6 cases of positive rabies virus has been detected, resulting in 5 deaths among victims. All of those are children. To date, thousands of pets, from cats and dogs and other animals, have been vaccinated. But does this help in the long run? Let's first understand what is rabies. The virus is transmitted through the saliva of infected animals. Nearly 100% of all cases are caused by dog bites, and once bitten, rabies is fatal. It is mostly children who get bitten by these infected dogs, and in the case of Sarawak recently, that has been proven true. Treatment must be given immediately once bitten to improve chances of survival. Currently, rabies affect those in poor rural places in Asia and Africa, where pet vaccination is also the poorest. In this country, it's also worth noting that Sarawak is among the poorest country, and therefore they are susceptible to this particular disease. It's worth noting that according to the World Health Organization, there is 1 death from rabies happening every 15 minutes. To stop this, we need to vaccinate dogs because it can save human lives, as it breaks the transmission cycle of rabies. Of course, the best method is still better to learn on how to handle dogs properly and teach children the same methods too. In Malaysia, the presence of dog-transmitted human rabies is still very low. But data from the WHO, or World Health Organization, shows that cases are so minimal in our country that it is recorded as near absent. This is interesting because cases of 2016 and 2017 leading up to the 5 deaths will change the landscape in this country going forward for cases of rabies. That is why the WHO ranks Malaysia as low risk and not no risk when it comes to the distribution of the risk levels for humans contracting the rabies. And of course, since it's World Rabies Day on September 28th, I want to focus on the target that the WHO has set on resolving this disease. Since 4 out of 10 deaths are children for rabies, it is important for us to teach them as adults on how to read and better understand dog behaviors. WHO targets 0 deaths by 2030. That is an ambitious target, and therefore it can only be achieved if countries around the world and in Malaysia continue with vaccinating animals and vaccinating people. Remember, rabies is 100% vaccine preventable, so go vaccinate yourself. The WHO website has fantastic tools that adults can use to teach kids on this. Let's celebrate the World Rabies Day by better understanding what you and I can do to stop this disease from spreading. Happy World Rabies Day, stay safe, and let's educate each other. You're watching Viva.